On that same trip, I met cardiologist Dr. Scott Lieberman, and he joins us now from Tyler, Texas. Dr. Lieberman, it's good to see you again. Thanks very much for joining us.
Good evening, Sean.
We just came out of a pretty sobering story about loss and heartache, and we do have a lot to get to, but I think many people in the United States are looking at what is going on in Sturgis, South Dakota, the big motorcycle rally that happens there every year, as many as 250,000 people there, no mask required. Are we looking at a super spreader, and what is your prediction of what will unfold in the coming weeks, and what is the U.S. going to look like in 3 weeks?
Well, it certainly could. One of the concerns about the whole concept of super spreaders is that a majority of the infections seem to come from a fairly small minority of the patients who are sick. Most people who get sick quarantine themselves, wear masks, limit their ability to spread this disease beyond maybe 1 or 2 immediate family members or people in the area. But in super spreaders, you end up having this population of people that, are in a mass group, and the ability to spread this virus amongst a large number of people that then redisseminate it around the country is potentially, very risky. But, we'll have to wait and see what happens. But I certainly hope people there are, minimizing the distance, minimizing the risk as much as possible, and maximizing the distance and wearing masks.
Yep. Now, you lived in the state of Texas for more than 25 years, a state very proud of its individualism and recently known for a dramatic spike in the number of COVID cases. Two simple things, wear a mask and social distancing. Why such a pushback in Texas?
Well, there's some of this was politically driven, some of this was internet meme driven, I might say. A lot of things, people felt were violating their rights. And I kind of understand their argument and where they're coming from, but the reality is whether or not it's a constitutional right to demand somebody to wear a mask or not, it can be a debate for another time. We all have responsibilities to each other, to your neighbors, to your family members, to try and reduce the risk of spreading the disease to someone else, and to try and minimize the risk of catching it from someone else. And so while you can make an argument if you want about civil liberties, the reality is civil responsibilities, I think, outweigh that.
Interesting. I also talked with you while I was in Texas about heart disease, still by far the #1 killer in the U.S. The fact that many people postponed elective surgeries out of fear of contracting the virus, either because they were canceled by hospitals or people didn't want to go in. What is the concern about people putting off those kind of surgeries? Are you worried about that at all?
Well, we're worried about it. In fact, we've seen it. In New York, we call an acute heart attack a STEMI. And in New York City, there was a significant drop-off in these acute heart attacks coming to the emergency room. And we saw that here during the first lockdown period in the springtime, too. And it was seen in places around. And the bottom line is there were a lot of people who had symptoms who felt it was riskier to potentially go to a hospital and get COVID than to deal with their acute heart attack. And many people died at home from this. And it's not just heart disease. There are people that are putting off cancer screenings and cancer evaluations and treatments for the same reason.
I have to ask you about the race to create a vaccine. A lot of hope. Is there too much put on this? And traditionally, how are these things rolled out? Like, who's going to be first in line?
Well, this is, I think, as far as first in line, I think you're probably going to see the frontline healthcare workers that are most likely going to be offered it first. I think the populations that are at highest risk are more likely to be offered it early on, particularly people who are older, who are more debilitated, have cancer, heart disease, hospitalized patients. I think, and apparently inmates, but any institutionalized population, I think, are going to be the groups that are going to have to be treated first. As far as the rush to development, I heard somebody make an interesting line earlier today. It's not that the science is moving faster than it hasn't before. It's that the government has maybe fewer hurdles in the way of reaching that goal. And so we'll have to wait and see. But we had a head start on this. We've had, work in MERS and SARS viruses in the past. We have, 40, 50 years of vaccine development history behind us. And we have newer technologies, better computers, better ability to generate the maps of these viruses and create targets against them than we've ever had before. And so the confluence of better technology and perhaps better management of the science is going to lead to an earlier vaccine.
Okay. Dr. Scott Lieberman, thank you very much. Always a pleasure to chat with you.
Thanks, Sean. Take care.